Welcome to the Dakota Show. Today we have a few special guests in honor of Lucy Johnson, a 9-year-old victim of acute lymphocytic leukemia. Um, Her mother, Abby Johnson, and I, Kaylin, are here today to join us. Welcome these two inspirational women. Along with her aunt and mom, we also have her intelligent doctors to give us a medical aspect on her disease. So, Abby and Kaylin, how did you know Lucy was developing cancerous symptoms?
I first started to recognizing strange things when Lucy was losing weight and getting sick really easily. She was very weak, and I was so scared for my little girl.
Abby would call nervous about these changes Lucy was going through. I suggested we should take her to the doctor, where they directed us to Dr. Dawson and Dr. Manor. They did everything they could for Lucy. Lucy was a true warrior, and she fought as long as she could. In the end, cancer won, but now Lucy's in a much better place.
Doctors, how would you describe the life of a victim with acute lymphocytic leukemia?
First off, leukemia is a cancer that starts in the blood-forming cells of the bone marrow. The patient goes through many symptoms such as fever, weakness, fatigues, headaches, pale skin, and vomiting. To explain, leukemia cells are carried in the bloodstream to organs and tissues, including the brain, liver, lymph nodes, and testes, where they continue to grow and divide. All progress rapidly, replacing healthy cells that produce functional lymphocytes with leukemia cells that can't mature properly.
Family history of any type of cancer as one of our first methods of diagnosis. We also look for other potential systems like bleeding gums, frequent infections, easy bruising, and weight loss, not to mention the intense side effects if the patient chooses to go the route of chemotherapy. The chemo side effects include great amount of hair loss, nausea, vomiting, pain, sores in mouth and throat, appetite loss, and memory issues.
Doctors, what type of medication do you prefer with this diagnosis?
The most success we've seen in dealing with acute lymphocytic leukemia has been chemotherapy. We've seen an overall 80% rate in all cure in all children. Unfortunately, Lucy was a part of the 20% that didn't make it.
Though chemo is extremely hard on the body, it has been proven effective.
Abby, what was it like seeing your daughter and Kaylin, your niece, go through such intense sessions?
It was extremely hard to see my daughter that way. My heart goes out to any parent that's going through the same thing I did. Lucy fought hard and strong. It was an emotional ride, but we were with each other every step of the way.
Lucy's remembered as a reminder to keep searching for that cure and to help other kids and adults suffering from brutal effects of cancer. She caused me to remember to never give up in any type of situation.
Here's a picture of Lucy going through chemotherapy. She battled hard and 10th round each and every time.
This chart shows some of the many places leukemia can develop, along with these symptoms.
Doctors, what is the latest with any current research to try and find a cure?
Well, the medical field is always doing clinical trials, trying to see what works for the patient. There is a new drug out to help improve chemotherapy called clofiramide. This medicine is proved to treat almost all childhood cancer cases.
Along with the new medicine, stem cell transplants are constantly being trying to be improved in their effectiveness to try and reduce complications. Lately, doctors have been trying to study donor leukocyte infusion in those who relapse from treatment. We still have a long way to go, but there's always hope.
Well, look at that. Let's have a big thank you to the family members, Abby and Kaylin, and Doctors Madden and Dawson for coming out today. People like Lucy are inspirations to find a new cure and broaden the horizon in the latest medical research. Join us tomorrow with another special guest. Until next time.